Okay, and we are going to share some documents today. So we'll make those available after, but we just wanted to get everyone's feedback and comments today, if there are any, so that we could incorporate them before they go out, so we don't have multiple versions in the universe. But I will show you some stuff, and don't worry, we'll send it to you after. Yeah, and then just a couple of quick intros. So on the call, obviously I'm Michelle. I'm the Senior Program Coordinator for BC Wheelchair Sports. We also have some of our staff. So Gail Hamamoto is our Executive Director. And then we have Anna Karanovic, who is the Program Coordinator for Athletics at BC Wheelchair Sports. We have a couple of our regional coordinators, Scott James and Brandy. I can't see you, but I know you're here somewhere. And then we also have Sarah Hunter, our provincial team coach, and Janet Petrus, who is the Director of Wheelchair Tennis at Tennis Canada. So we're happy to have everybody, and hopefully today we can have some good clarity and discussion about what's been going on. So just first of all to say thank you for your patience on all of this. I know it's been a trying time for everybody, and trying to know what the right next steps are and where you should go from here, when you can go back to programming, has been difficult for all of us. We are doing our best to get you information as quickly as possible. But that being said, we don't want to put out information that's incorrect or that will have to be changed later. So we're really trying to go slowly and be methodical and do everything right. So thank you for being patient with us. Hopefully after today, I'll have a bit more clarity about where we're going and what we're doing. And then if you have any questions, or if at any point after this you want to reach out, please know like my email is always open, and I'm happy to talk on the phone or on Zoom if you just need clarification or you're not quite sure about anything we talked about today, or about how to move forward or how something's working within your facility or your club or your program. Yeah, so we're gonna show a PowerPoint, so I'm gonna do that now, and everyone should still be able to see the chat. So let's see if this works. Good. And then I don't know how you see can someone give me a thumbs up if they can see the chat? I don't know if it's just, yeah, okay. So I can't see it, so Gail is gonna monitor questions. Okay, perfect. Okay, so yeah, today we're gonna talk about, we're gonna provide you an update on where we are. We're gonna talk about what's happened so far and where we're going, and hopefully next steps, so you have a bit more clarity around what's happening and what to do. Okay, so first of all, some definitions. So today we are talking about sport. So sport is organized sport activity. It's facilitated by a provincial sport organization, which BC Wheelchair Sports is, or a local sports organization, so like a club or a community sport organization. It's organized sport. So that is what we're talking about today. Recreation, on the other hand, is freely chosen participation in physical activity. And physical activity could be leisure, fitness training, or sport-related activities. The difference is it's at the discretion of the individual, and it's self-led, or it might be facilitated by recreation leaders, so in a municipality, but not by sport leaders. So recreation and physical activity is not under the purview of BC Wheelchair Sports Association. So when we talk about what we are not sanctioning at this point, we are not sanctioning participation in sport. And I'll get into that a bit more, but if someone chooses to go and play wheelchair tennis or any other sport at a municipal or public facility, or even if they pay for a court at a public facility, that is on them. Like, that is self-driven, and that is technically physical activity and recreation. So just so we're all clear, because I know sometimes when we put guidelines around stuff, it can feel a bit like, well, can't I just go do that? And yes, the reality is individuals right now can go and play wheelchair tennis, but we are not involved in that in any way. Okay, so at this time, BC Wheelchair Sports is not funding, endorsing, or sanctioning any organized sport activities, and everything else is at the sole discretion and risk of the individual. And the reason we need to be so clear about this with everybody is at this moment, and probably going forward, BC Wheelchair Sports and other sport organizations in the province do not have liability insurance for contagion-related illness or injury. So we need to protect BC Wheelchair Sports. And we need to make sure that before anyone goes back to playing, and our participants, but we need to make sure before anyone goes back to playing, we have all the guidelines in place to keep everyone as safe as possible. So at this point, we are unable to fund, endorse, or sanction any activity. So that includes if BC Wheelchair Sports is subsidizing a program. So even if it's just 1 or 2 people, if we are subsidizing that program, that cannot take place right now. And if we are paying for a program or paying a coach to coach a program, none of that can happen right now. And yeah, does that seem clear?
Can I just add something there, Michelle? Yeah. So with respect to the insurance question, just for some further clarity, there are very few provincial sport organizations that we are aware of, certainly none that are insured through Sport BC, that are able to get contagion insurance coverage. In fact, ours now has a specific inclusion or exclusion clause. So that means that BC Wheelchair Sports and all of our member clubs and programs do not have a specific coverage aspect to any kind of contagion. And that's why Michelle will speak to a lot of the other mitigation factors that we'll be getting to in our recommendations and guidelines. And what everyone needs to keep in mind is that that means everyone is exposed then in terms of legal liability, extending to coaches, to club volunteers, to our board members and our staff. So that's why we have to be extremely diligent and careful on how we move forward.
Yes. Okay. Sorry.
Sorry.
I wanted to make sure there was no one else in the waiting room.
Yeah. Right. No, that's okay. Janet just popped a question into the chat and asked, when will the insurance issue be rectified? In terms of our own insurance that we have, we've not been given any indication that we will get insurance, that anyone will get insurance. Obviously, it's a moving target, but I would say probably 90% of the organizations I've talked to, if not more, are unable to get this type of insurance. And to be clear, contagion insurance was never included in anybody's policies really, or in very few policies. It's just that now it's front and center. You know, for example, if you had gotten measles at your local tennis program, that's not covered by any insurance policy. But now, because COVID is so prevalent and so dangerous, it has become a topic of conversation in insurance. And so the best advice we have moving forward is to put in the various risk management factors that Michelle is going to cover in this presentation in order to make people very clear what the risks are and share that risk across individuals and organizations.
Okay, so if there's more questions, we'll go a little further and then we'll pause again, and then, you know, that's like, whoa. But that's what we're working with. All right, so back to this. Okay, so timeline, so just where we were. So March 13th, BC Wheelchair Sports suspended all sport programming until further notice. We didn't do this under the order of the province or the provincial health officer, but out of an abundance of caution for our members and our coaches and our staff. We felt it was the right move. A week later, we extended that suspension until May 30th when it became clear that we weren't going to be going back to a normal anytime soon. May 8th, Tennis Canada canceled all tournaments up until August 31st, so that resulted in the cancellation of the Vancouver International and Kamloops Legacy Games tournaments. To be clear, we were also leaning in that direction, so this isn't a Tennis Canada made us cancel the tournaments, but they took the leadership on it, and we appreciate that. And then May 19th, the province of BC moved into phase 2 of the provincial restart plan. So we'll go over that in a second and what that meant for sport and recreation. And then May 30th, we, as promised, put out another update and extended the suspension of program until June 30th. We'll talk a little bit about that today and what that'll look like. It doesn't mean that after June 30th, we're going back, but it might mean that we're going to be ready to have some discussions, and we might be ready to have some of those discussions and start doing some things earlier, but we will continue to provide updates on social media and our website as things change. And then June 1st, so Monday, the sector return to sport guidelines were released by Via Sport. So we'll go over that today and what that means. That is something that we've been waiting on in order to be able to move forward. So that is where we are at right now. All right, so this is BC's restart plan. So as of today, we are still in phase 2, and that means that there is restoration of some services under enhanced protocols. So within that is recreation and sport. And what that has meant so far is that municipal facilities and some public facilities are open and people are going back to playing recreationally. What it has meant for us and for the provincial sports sector has been that we are able to start the work and start towards looking at a reopening. So I recognize like we've been open for a little bit, but it takes some time, and until some things were in place and there was some clarity, we couldn't just go back to recreation and sport. And then this, and I know this next slide is hard to read, but we will link to the Via Sport guidelines in an email following this presentation, so you can look at it all yourself if you would like. Via Sport, which is the provincial sport body, has released also a phase chart, and currently we are in the transition measures phase, and they envision that we will be there until September. And within that, there is a return to sport with a lot of additional considerations. So maintaining physical distance, increased hand hygiene, playing outdoors is recommended, small groups, no contact sports, no competition, or limited competition within a club if you feel you can do it safely. For all of these phases, I would say that although at any point we might be allowed to do a certain thing, our approach is going to be cautious because of the nature of our membership. Not everyone is going to be at increased risk necessarily, but some people are. And so we need to be very careful about what activities we go back to and how we go back. And we might be taking a slower or more measured approach than able-bodied tennis or other sports, but in my opinion, that's okay if we keep everybody safe. So just so everyone's clear about where we are going with that. Also today, there is a webinar at 1:30, and I'll send the information out right after this. Via Sport is giving, they already gave a presentation to us on the guidelines, but at 1:30 they're doing a webinar for recreation leaders, facility leads, and municipalities. So if anyone's interested, you're free to log on to that and we can provide some info, and you can get a bit more clarity around what they are doing. So the Via Sport Return to Sport guidelines are going to inform what BC Wheelchair Sports and all provincial sport organizations do. And we need to follow all of those guidelines and then create our own guidelines. Okay, so next steps. So today we are happy we're going to be able to release return to play recommendations for recreational participation. So I'll talk about that a bit more. These are not return to sport guidelines. That will be the next step after. Those guidelines will need to be approved by our board of directors. And so until that work is done, we will not be returning to sport. And within those guidelines, there will be overarching BC Wheelchair Sports policies, which will apply to all of our sports. So illness policies, outbreak management, etc., which we'll discuss further. And it will clearly delineate how we can return to programming and all of the protocols and systems that need to be in place to do so. And just to say, within BC Wheelchair Sports, the sports are all going to go back at different times and in different ways. So what I'm saying today relates to wheelchair tennis, but it certainly does not relate to wheelchair rugby. And we're going to do our best to go slowly and in a measured way with each of our sports. It's going to look different for each of our sports. And if you have feedback on that, if you could fill out the survey that I sent out yesterday, that will really help us to know how people are feeling, what they'd like to see, what their concerns are. And I'll send that link out again, but it was in the email yesterday.
And Michelle, just to build on that comment, that difference in the timelines in terms of when our sports are going back can be seen across the sports system. So as we participate in calls with VIA Sport and with Sport BC, there are very clear groupings of the timelines of sports. So individual outdoor sports are going back sooner than team sports, and individual sports can go back. And so that is really reflective of sort of the common approach in sport right now. As many of you can appreciate, if you're in an indoor team sport that involves contact, there's quite a bit more risk than if you're in an individual outdoor sport. So that's the thinking behind those approaches.
Yeah, so just for those of you that are involved in more than one of our sport, I'm sure like we got questions when tennis started being played in parks and public spaces. So as soon as wheelchair tennis programming goes back, I'm sure you'll receive questions about other sports. And it's just one sport at a time, and everyone's moving at a different pace for the safety of everybody. So within wheelchair tennis, we will be looking at a phased approach to return to sport. So we will start with individual training and coached sessions. That's the easiest way for us to maintain all of the recommended hygiene protocols and physical distancing rules at the time. Then move to small group lessons, eventually, and I'll talk about this more, training camps, clinics, local competition, and at some point when there's a new normal, a resumption of all activities. Okay, so first of all, return to play recommendations. So as I mentioned, these are recommendations for individuals choosing to play wheelchair tennis at their self-driven and under their own discretion. But we wanted to put out some recommendations because we know people want to go back, and some people already have gone back to playing. And frankly, we don't have the power or the need to stop them, but we want to make sure that they're doing so in a safe way, and that if people are considering going back and not really sure what they should consider or think about, that they have this to at least get them started. It is compiled of recommendations from the International Tennis Federation, Tennis Canada, Tennis BC, and provincial and municipal health authorities. It's the currently understood best practices for participation for the general population, and that's important. There are not a lot of para-athlete or wheelchair tennis specific guidelines out there in the world right now. And part of that is because para is such a broad term, and what is true for Rob Shaw with a quadriplegic spinal cord injury is not going to be true for a Barry Henderson, for example, who is an amputee. So it's difficult for us and for anyone to provide guidelines that encompass all of the various disabilities and experiences of people playing wheelchair tennis. But it's important to recognize that individuals living with a disability may be at greater risk of negative health outcomes related to COVID-19. And so for all your participants, anyone you're working with, you really need people to assess their own health risks and safety and preparedness of their local tennis club when considering returning to play. And we really want to make sure that anyone that does have an underlying condition and that might put them more at risk consults their physician or does everything in their power to make sure that they're going to be safe.
And so to add to that, just two things that we are keeping our eye on as we move through this process. One is at the international level, the Canadian Paralympic Committee's Chief Medical Officer, Dr. Andy Marshall, is meeting with Chief Medical Officers from National Paralympic Committees from many other countries. And they are trying to gather and share information specific to our para populations. As a member of the board of the CPC, I'm going to keep my eye on that and make sure that any of that information gets translated down into the work that we do. Additionally, VIA Sport is leading the development of a few more sort of working groups or expert groups, one related specifically to disability in sport and another sort of sports science and medical group. And so we'll keep our eye on that. I think as with everything with COVID, the information is ongoing in terms of when we get it and how it evolves. And so this is the information we have at this point in time, and we'll continue to update it as we get it.
Yeah. And similar to what I said before, anywhere that there's been a discrepancy between what maybe Tennis Canada and Tennis BC is saying, we've taken the more cautious recommendation. So anywhere that we can, we've been as cautious as possible so that we're giving the best advice. And we feel confident that this is the best advice at the moment. But if it changes, then we will certainly share more information. Okay, so key points within the document, and I'll show you. This is the document. It's not short. So we will distribute this after the fact, but it's significant, but not, I will say, the 50 pages of the other guidelines. We tried to pare it down so it's user friendly, and we'll distribute this to everyone and post it online so you can share it with anyone that you think might benefit. So at this time, we're recommending that you play only with people within your family, household, or bubble. So according to the province of BC, if someone is within your bubble, which means you've extended them into your close social contacts, then they are part of your bubble now. They are safe. They are considered a member of your household. For those people, so for me, that would be my mother and my mother-in-law. I don't need to maybe be quite as stringent with the distancing. For anyone else, you know, you're allowed to see other people now. You need to still be very careful about how close you get to them and sharing equipment and everything else. If you're going to play with someone outside of your bubble, and recognize that most people will do this, you need to maintain all of the recommendations that we give and all of the provincial health officers' recommendations. So that's staying with 2 meters away from them and everything else that goes with that. And then in that case, we recommend that people play with the same people. So you're not playing with person A one day and person B, and then person B played with person C and D, and then all of a sudden you've all contacted 25 people. And that's going to be the recommendation going forward. No one should be playing, obviously, if they're experiencing any symptoms of a cold, flu, or COVID-19, and this is laid out in the guidelines, or if they've had those symptoms in the last 10 days, or if they have traveled outside Canada in the last 14 days, or have been in contact with someone who has traveled outside Canada in the last 14 days. This is all provincial health guidelines. This is not something I pulled out of my hat, but we got to be very clear with people and make sure that they understand this is the current recommendation. No one should be sharing equipment. So at this time, we're recommending that players bring their own tennis balls and clearly mark them, and that they serve only with their tennis balls. So if your opponent wants to return balls to you, they can do so with their racket. They should not be picking up your tennis balls, and you should not be picking up their tennis balls. And we recommend marking them with a marker because it's easier to see than maybe if you both have different numbers or you both accidentally show up with number ones. This is just, again, if you're touching stuff with your racket, then hopefully you're not touching your racket and touching your face, but you are more likely to touch a tennis ball, continue playing, and wipe sweat off your face or something. Everyone needs to practice good hygiene, obviously, hand washing, use of hand sanitizers, don't touch your face, respiratory etiquette, which is coughing into your sleeve or a tissue, disinfect frequently touched surfaces, and that would include all your equipment. So rackets, towels, bags, water bottles should be disinfected before and after you play. Everyone needs to maintain a 2-meter physical distance at all times. So this time we're recommending singles only play if you're playing recreationally with someone else, and that you don't change ends of the court. You just stay on one end for the entire time. Just decreases the amount of traffic between nets, because we know between nets is a lot tighter than on an open tennis court. And at this time, players should arrive at the venue close to their playing time. So I know that's difficult in public courts where you have to line up for a court. So maybe at this time you shouldn't be playing at Kitts Beach Tennis Club where it's quite busy. But if players are coming to your club, that they show up right before their court time, that they're dressed and they have everything they need to play. And for us, we would recommend that players leave immediately after, and that they don't rely on public facilities. So should bring with them sanitizer wipes and all their clothing and water and food, so they don't need to rely on any public facilities. All right. Do we have any questions about that before I go forward? Okay. If you have questions, type them in and I'll pause. Okay, so the phased approach to wheelchair tennis that we are looking at taking right now. And so to be clear, these levels, they look similar to the provincial phases or the diagram for VIA Sport, but we are going to move at our own pace. So just because the province moves to phase 3, we are not then on level 3 of our plan, and we will communicate where we are. And if the province moves to level 3 and then regresses back to level 2, then we might look at also stepping back what we're doing. So as of today, and after we release our guidelines, and we are in level 1. So that is non-sanctioned, self-led, individual-driven participation in wheelchair tennis, so recreational play and individual training. Level 2, which would happen in July, likely by the time we get all our protocols in place, would allow for individual coaching and a progressive return to small group lessons. And then those are obviously provincial sport organization facilitated. At this time, we're going to do our best to have outdoor programming only. So for some places where we currently support programs, it might mean that we don't go back to that program right away. And it might mean that we don't have as many programs to offer. So I know we've done a really great job over the last couple of years of expanding our programming so people don't have to drive as far to get to programming, which I'm grateful to all of you for that. But now we're going to take a step back for a little bit and just make some conscious and strategic decisions about where we're going to operate for the next little bit. And we'll move to level 3 at some point to allow for training camps, clinics, local competition, meaning within clubs or people. Like, so we're not going to be flying to nationals or driving to Alberta, but we might allow some, people in the valley and competition that we would arrange. We might move to some indoor programming, which we all know in Vancouver, it's going to be a necessity if we're going to continue programming. And that'll continue to look, we'll continue to look at the risk in the province and in the general population and how safe we feel moving to indoor programming. Outdoor is just safer because it's easier to physically distance and there's better ventilation and there's fewer things for you to touch and for players to touch that then need to be cleaned. And then level 4 will be a new normal, and that is where we will stay for the foreseeable future when we ever get there. It will be a resumption of all sport activities. There will likely be additional considerations going forward around hygiene and protocols. We've learned our lessons now, and it's conditional on BC reaching phase 4 of their plan, and that is conditional on there being vaccine or widespread community transmission and immunity, which is a ways away. So just to say, this is what we're looking at. This is why we're moving slowly. It might, and for some people, it's going to feel very slow. And I know for other people, it's going to be like, whoa, slow down. And so we recognize that people have different feelings, and we're not going to push anyone to do anything they don't want to do or they're not comfortable doing. But this is currently what we're working on. I think there's some questions before I move on.
Yeah. So question from Janet, what level do you think you would need to be in to travel to nationals at the end of October in Quebec?
So, I mean, it's a difficult question because I think we're in a very interesting position in BC that we have much lower case counts and lower transmission than the rest of the country. So do I necessarily want to put if our BC players are allowed to compete locally, do I necessarily want to send them to a province where it doesn't feel as safe? I don't have the answer to that right now, but I'm leaning towards no. And of course, there's some individual choice, obviously, within everything. But yeah, it would be interesting if we were going to a province with similar levels of COVID than us. It might be a little different, but then there's still going to be people coming from other provinces, traveling through airports. I don't foresee it, but this all happened very quickly, and things are obviously changing very quickly. So I don't want to say no to something, but certainly if we were still like somewhat where we are right now, then we would not be looking at doing any cross-country travel.
Yeah. And I think there's several factors, and we've touched on the insurance bit, but also, I mean, our overarching philosophy is, what is our duty of care? And so what is our duty of care as an organization for our athletes and our coaches and our support staff? Like Michelle said, until we get kind of closer to the time, it's very difficult to understand the risk that would we would be putting our team in if they were to travel. So it's a moving target, unfortunately. There's another question from Eva. It says, what is considered a small group? I have 3 to 4 juniors normally.
So at this, in our current guidelines, which we're not releasing today, but which we will be releasing, we are looking at a maximum ratio of 4 participants to 1 coach. And I will talk about this in a little bit. That's assuming that you have enough space for them to be physically distant easily within whatever space you're training on. At this time, if you're using an actual court surface, I would recommend 2 players per court. So if you have 4 people, it should be 2 courts. Eva, I think it's more a gym facility and smaller kids. The other thing to consider is that smaller kids, it's a little harder to physically distance them. And so, yeah, we just want to make sure that they have enough space that they can easily stay apart from each other. And whether that means actually delineating this is your quadrant and you cannot leave it, that might help a little bit.
So Eva says, I'm going to be using outdoor courts.
Yeah.
And then just to back up what Michelle says, I think a lot of what we're seeing in the sports system right now is literally putting cones between spaces so that athletes can't inadvertently get into anybody else's space. And it is, as Michelle said, even more difficult with small children, younger children who are just naturally rambunctious and want to be next to each other and want to get close. And so I'm sure you guys have all seen videos of either hula hoops delineating space or cones delineating space or people wearing strange things on their heads to delineate space. But I think it'll be really important for coaches to be using other visual cues for athletes in order to maintain that physical distancing.
Yeah. And Eva, we can, I'm going to talk a little bit about municipalities and the difference between that and a club program in a little bit, but we can also discuss further, and I'm happy to have further discussions with you because I know they're very small and very cute and we want them to go back to playing, but we just have to make sure that we can do it in a safe way for everybody. Okay, so back to this. All right, so within our phased approach, level 2, as I mentioned, will be the release of return to play guidelines that are going to be approved by our board. So everyone's aware, we have written guidelines. They are constantly changing, and they have gone to our board for examination, or I can't think of the word right now, but for them to look at and give feedback on. So some of the key changes within that, so all participants for all of our programs are going to be required to sign updated waivers or an acknowledgement of risk for those under 18 and health declaration forms. So everyone needs to understand. So we're going to be front and center putting that COVID-19 is a risk and other contagions because it is unlike it's ever been before. And a health declaration, meaning they understand the risk of COVID-19 and that we're going to do everything in our power, but there are still risks. And then we will require that players self-certify that they are in good health and not experiencing any symptoms before each lesson. And coaches will be responsible for watching for visible symptoms, making sure that players sign off that they are not experiencing any symptoms. And as we alluded to earlier, all of these things are necessary and in place to keep everyone safe, but also because we need to do everything in our power to not allow spread within our programs because of the insurance piece.
And
because
to be clear, and to be clear, as coaches and people who run clubs, you need to understand that a waiver does not protect you from a lawsuit.
Yeah.
And what it really does is make sure that you as a coach or as an organization have clearly outlined the risks to your participants and that they have signed and said that they acknowledge those risks. And in the case of a minor, a parent cannot waive the right of a minor to sue. And so that's why it's called an acknowledgement of risk for someone under the age of 18. The parent can simply acknowledge the risk. The minor could at some stage decide to sue if they've been injured or impacted in some way for any reason. So we have to be very, very clear that a waiver is a tool. It is helpful in a court case because it shows that you've done your due diligence and that you were very clear with the participants what the risks were and that they accepted those risks. But if there is negligence on the part of the organization, on the part of the coach, and someone gets ill or injured because of that, then your waiver isn't going to necessarily protect you from any kind of lawsuit or negative outcome.
Yep. Yeah. All right. So as I mentioned, 4 participants to 1 coach and a max of 2 players per court. And I don't think most of our programs fall within this already. We're smaller groups than some other sports. So, but that's going to be the requirement going forward. Lessons will need to be staggered to allow times for arrivals and departures. So right now, I know, one lesson ends and the kids are waiting at the door and the other lesson comes in. That's something we're not going to want to see anymore. We're going to want to allow people time to actually exit the facility before the next group comes. And that way, we can make sure that people are staying apart, and that when if you ever have to report to public health that person A was sick and these people were in that group, that you don't also have to say, but they passed this group on their way out. And within that too, we're going to want to encourage that people leave. Like, they don't stay in the parking lot and chat. And of course, everyone has their individual rights, but as much as possible, we want people to stay apart. All programs are going to require registration, and all registration will be completed online. So this is a little bit of a change. We've always offered online registration, but we've also allowed drop-ins or other methods, showing up, calling the day of. For people that have trouble accessing the internet, we can still do phone registration, but it needs to be ahead of time, and we need to be able to know who's coming, because we can't have a situation where too many people show up at one time. Or someone we don't know is coming, or they show up for the wrong lesson, or all of those things that we've run into before, we're going to try and avoid. At this time, we are recommending that players needing assistance with transfers or taping get it from a member of their household, and not from coaches. And, that's twofold. It's for our coaches, going back to work for some of them is going to be nerve-wracking. And as much as possible, they should be able to keep their distance from all the players. We recognize, though, that this is going to be difficult, and it's going to change the way we do some things, in all of our sports. We've always been the people to be like, yep, we're here, let me help you, what can I do? We're going to have to take a step back from that a little bit for the time being. And so if someone needs assistance, we're going to ask that they let us know ahead of time, and that we can make arrangements for that to happen with a member of their household. And if they don't have a member of their household, then that will be a further discussion between us. And I would ask that if anyone runs into that situation, that they reach out to us and say, what do we do? Because we don't want to exclude anyone, but we need to keep everybody safe and not take unnecessary risks.
And that's another reason why we've sent out the survey to our members to say, what supports do you have and what supports do you need? So that we have an understanding of how many of our members would be unable to participate in our programs because they don't have the necessary supports. And we will certainly do everything that we can within safe sort of measures to support participation. Obviously, that's at the heart of everything that we do, so we will look into that. We are also looking into training through the Red Cross in terms of how to use personal protective equipment and what the responsible use of that might be. So all of these things that we're working on will hopefully inform us in terms of being able to support participation in our programs.
Yes, exactly. And just to say, there's a hierarchy of how to keep yourself safe, and the biggest thing is to stay away from other people. So maintain that 2-meter physical distance. Personal protective equipment is important and it has its purpose, but if we can do it in a different way, then we want to keep people apart, because that's the safest way to keep people from getting sick. All staff will be following a new BC Wheelchair Sports illness policy and outbreak protocol. So when we release our guidelines, we will have those documents in place as well. And it will make clear what happens if someone gets sick, who you report to, and what steps need to be taken. And then, as I mentioned before, if there's a regression in the provincial phase, then we would probably go back to reducing what we're doing, just so everyone's aware.
So there's a question from Sarah in the chat. It says, does this mean parents come onto the court to transfer their child and then leave the court?
So ideally what would happen is parents transfer their child either on the edge of the court or right outside the court, and then they leave. At this time, we're also going to be discouraging spectators. So I know parents love to sit and chat and everything, and we're not going to encourage that. In some facilities, it'll mean that they can go back and sit in their car and still see their child on the outdoor courts, but that they're not actually on the court assisting in programming, as I know happens sometimes, or otherwise. With really small children, that might be a problem, and so those are going to be discussions that we're going to have. Yeah, and that's really, you know, how we're looking at it, and that they would arrive before the lesson. So ideally, they would arrive before everybody else, or they would be in a delineated space, and they would not leave that space to assist their child, and that other participants would be in other delineated spaces to do transfers. And then they would leave. Yes. And that we would assist people in communicating these things to spectators and parents. Yeah. All right. So the last thing is specific to coaches and clubs. And that's why we did 2 sessions today. So we are going to work with tennis clubs and municipalities running wheelchair tennis programming to ensure alignment of facility and BC Wheelchair Sports Association protocols. I know everyone is putting in place protocols, but because of the nature of our participant population, we need to make sure that they are stringent enough, or that what we require to happen can happen within each facility. And so for everybody that runs a program for us, we're going to be asking to see your guidelines and your protocols, so that we can make sure that everyone's going to be safe. We're reasonable, and as we've always done, BC Wheelchair Sports will coordinate the signing of new waivers and health declarations along with registration, so that we make sure that we get it all back, and it's not on the onus of the coach the day of to figure out who's done what. Coaches, though, will be responsible for ensuring participant has signed the health declaration each time and that they have no visible symptoms. Obviously, I can't be at every program. And the other thing is we're trying to keep the number of staff at each program to a minimum. It just allows more space between participants and reduces the number of contacts that any individual has. And then the last thing, and Eva, this speaks to you. So wheelchair tennis programs not operated or funded by BC Wheelchair Sports or its clubs are not necessarily beholden to our policy. So as I mentioned before, recreation and sport are different, and municipal, sorry, that's my dog, municipal sport organizations and provincial sport organizations are separate and different and guided by different guidelines. That being said, we would like to see that clubs are taking all the necessary, or municipalities are taking all the necessary steps to ensure the safety of our players, given their increased risk. And we would like to be involved in any discussions with municipalities or with anyone else to make sure that those things are in place. So to be clear, if it's a private club and an individual athlete is paying a pro, that is not under our purview unless we are paying for it. So unless I arrange it and I say, Tony, on this day, you're coaching this person. If an individual athlete, so mostly high performance athletes, are paying their personal coach, that is individual driven, but we would still want to see all of these things in place. And if we are paying for a program or operating a program at that private club, then that doesn't apply. And everything that I just said does apply. You need to follow all the guidelines and recommendations and waivers and registration.
And it's important that the coaches are taking accurate attendance lists at every session, and that they are submitting those attendance lists to us. Now, this will all come out in the guidelines, the second sort of set of guidelines that we'll send out, because if we do have to put into place an outbreak protocol and we do have to contact trace everybody, we need to know exactly who was at each session. So those are requirements that we have to follow as well. There's also another question from Janet in the box. Are coaches at risk for any liability? So yes, you know, our existing insurance coverage is far-reaching and would cover most things that a coach may do if they're, you know, funded by BC Wheelchair Sports. But the fact remains that COVID-specific insurance does not exist. And so that is why we're asking the coaches to follow all of the protocols that we're going to put in place. We're relying on coaches to do that. One of the things I did want to ask is if any of the coaches are they themselves incorporated as their own business, if they have their own insurance and what that insurance coverage might cover, or if their club has its own insurance and what that might cover, because that's another layer that's outside of us that might also protect them. So perhaps that's something that Michelle can communicate with individual clubs and coaches on, and so that we just have a bit of a tracking list of who has what type of coverage. But currently, yes, unfortunately, we are all at risk. Our board of directors is at risk. Our staff is at risk. So with that being said, if a coach decided that this was not a risk that they were willing to take, then we would respect that. By all means, you know, each individual person in this situation, whether it's a participant choosing whether or not to go to a lesson, whether it's a provincial team member choosing whether or not to engage in the program, we respect that. And, you know, we've taken the stand that no one would, that wouldn't have any negative consequence. So let's say a provincial team athlete chose not to return to programming once that level of programming was open. We would not say, okay, you've not met the criteria now for selection, because that is an individual choice, and everyone has to assess their own level of safety and their own level of comfort depending on their personal situation. So yeah, unfortunately, that's where we stand. And that's been very hot topic across the entire sports system. Every VIA Sport call, every Sport BC call has a large insurance component. That is why legal advice has been gained in terms of creating the waivers that we will be sharing with everyone. Those have been drafted by lawyers to give the maximum amount of protection and the maximum amount of risk management. And at this point, that is considered best practice in light of the insurance situation. The next question was, are you able to share the PowerPoint and can we share it? I believe that, I don't think that there's any reason why we couldn't share the PowerPoint.
No. Sorry, I disappeared for a second.
That's okay. Yeah. Yeah, no, I think it's fine to share the PowerPoint. I can't think of any reason why we wouldn't, Michelle.
No, I don't think, and it's in the recording, obviously, which we're going to share. So they're going to see it anyway. So yes, we can share the PowerPoint, and we can share, if you want to go back and take notes or whatever, and we can share the webinar. And we will, after our second call today, share the recommendations document.
Yeah, so to be clear, what you would get today is the recommendations for individual non-directed play in the community. And then before we resume our actual sanctioned programming, then you would receive the return to play guidelines that are more comprehensive. That would be board approved.
Yeah, and so we're doing a second session this afternoon with our participants and any parents that wanted to join. And so they will all receive the same information, and they will all receive the recommendations as well, and they'll be posted everywhere so that people can see them.
And when you get the guidelines, you will get the full suite. So you'll get the guidelines, you'll get all of the waivers and risk assessment forms, you'll get the health declaration, the illness policy, and the outbreak plan. So it's a full suite of information that will be provided to everyone that's involved in our program.
Yeah. All right. Is there any more questions, comments, concerns? If it's easier for someone to just say something, you should be able to unmute yourself now, or we'll read questions out of the chat box. Sorry, my dog.
And also any input. So, you know, none of us are experts in this space. We've all been reading nonstop all the materials that are coming at every level and trying to do the best that we can. But please, if you have input, if you see a gap, if you have a scenario in your own experience or as a coach or someone who is part of a club, please let us know. I think that our collective brain and our collective input is much stronger than any one of us individually. So please do not hesitate to say, hey, I think you're missing this piece, or, you know, this piece looks like it's going to be problematic once I think through, you know, implementing it in my club. Can we work it through? Because I think the reality is this is an evolving situation. Once you see the recommendations document today, again, if you see gaps or have any input, please send it through so that we can incorporate into the guidelines document that will be coming out later on. We will, as much as possible, try to have some consistency across our sports and some alignment across our sports, but due to the sport specific nature, team, individual, outdoor, indoor, there will be differences.
Yes. All right.
Thank you, Michelle.
Thank you, everyone who attended. Yeah, we'll send this out, and it's just good. We just wanted to be able to connect with everybody and really, we didn't want people to feel like they were in the dark or that they didn't know what was going on. So thank you all for taking the time today. And if you have questions that you don't want to ask right now, and you want to ask me later or Gail later, then absolutely, we'd be happy to receive those. And yeah.
There's lots of thank yous in the chat box, Michelle.
Okay, awesome. Okay, so we're gonna shut it down for today, and look for. I'll send out the Via Sport info for the webinar for those of you that are interested now, and some of the documents. I'm going to send the recommendations at the end of the day, just in case there's feedback by players that we don't anticipate there being any, but just in case. And then that way we'll have one document out for everybody and not have to send you a new one in 5 hours. Okay, so thanks very much, and hopefully we'll talk to all of you soon. Stay safe, stay healthy.
Thanks, everybody. Stay safe.
Yeah.
All right. See you guys.
Bye.